Okay, so good afternoon, everybody, and welcome to the fifth annual Mental Health and Addictions in Construction webinar. Um, just to kick it off, we've got a great agenda, and we've got two ministers that are going to speak. We've got the CPO, and we've got representatives from across the construction industry, both people working in construction as well as associations that support it. This conference, or I guess webinar, wouldn't be possible without the hard work of the ResCon Health and Safety Committee, and then specifically Ahid and Meredith. As we all know, they're the ones that do the heavy lifting. And so this event is really to continue the conversation that we were able to start with ResCon 5 years ago. And it really picked up and tries to understand where we're at. What are we doing well? What do we need to improve? And really just to see the industry for what it is and to see where we're at and where we need to get to. We don't anticipate this conference ever ending because we don't think that this is an issue that's ever going to go away. This is no different than physical health. Mental health is important. It's part of physical health. It really impacts everything you do and every part of your job site. So when you look at it, what we've been able to do today is we've been able to collect a number of resources that we're going to share. This recording is going to be made live to everybody. If you've got some great resources, though, please feel free to put them into the chat. And one thing that we're doing is the mental health community in construction is growing. The number of resources is growing. What still needs to be focused on is there's still a lot of mental health issues. There's still a stigma associated. There's still people that don't feel like they can speak up and they're worried to speak up. And so these are some of the things that we're going to address. We're also trying to focus on traumatic mental stress. We're trying to focus when there's a suicide in the construction industry, whether it's a worker or a member of the public. And for a number of our segments, we're going to have a question and answer part to it. And so please use the Q&A function. But also you can send us a text or you can put it in a chat if you don't feel comfortable having the question put in the calendar. So with that, you didn't come here to hear me speak. Ahid, I think, is going to queue up a video of our first keynote. Sorry, before I do that, it's very important. We do need to do a land acknowledgement. And so I'd like to respectfully acknowledge that we are situated on the traditional territories and treaty lands, in particular of those of the Mississaugas of the New Credit First Nation, as well as the Anishinaabe of the Williams Treaty First Nation and the Huron-Wendat, and the Métis Nation. As ResCon's office is located in Vaughan, we are grateful to have the opportunity to work and live in this territory. And so as Ahid turns on the video, I'm going to introduce our first keynote speaker. And so our first keynote speaker comes from Michael Tobolo. He is the MPP for Vaughan Woodbridge, and he is the current Minister of Health and Addictions. This portfolio was actually created for him, and you couldn't find a better person to create it for. He spent a lifetime focused on mental health and addictions, holds another of designations and certificates, but more importantly, he has a real passion for this. He's been the keynote at most of our mental health webinars, and when we were able to have it in an event. And not only does he understand the mental health and addiction file, he also really understands the construction industry, and he's able to speak with compassion and passion, and he's able to understand it from the construction industry's point of view and has been instrumental in increasing the number of supports that are there for construction workers. So if you do get a chance to see him talk live, I strongly encourage it. With that, I'll turn it over to you, Ahid.
Hello, everyone. My name is Michael Tobolo, and I'm the Minister responsible for mental health and addictions for the province of Ontario. I'm honored once again to have been invited to ResCon's annual Mental Health and Addictions in Construction webinar, this being the fifth. And although I can't join you live, it's a privilege to still have the chance to say a few words to all of you. ResCon has been at the forefront of leadership and innovation in Ontario for years. You are a tremendous partner to our government as we continue working on our plan to build 1.5 million homes across the province. And you are leaders when it comes to mental health in the workplace. Today's webinar is a crucial platform for dialogue. In this space, I hope you all can openly address the mental health and addiction concerns that impact our colleagues, our friends, and family within the construction industry. Mental health and addictions affect people from all walks of life, and the construction community is no exception. The pressures and demands of a career in this field are substantial, and it's our collective responsibility to ensure that our workers are supported, they're heard, and equipped with the resources they need to navigate these challenges. This forum is also an opportunity to address a very real and very serious issue that construction workers have been dealing with over the last few years: overdoses. A terrible fact is that in this province, of people who were employed at the time they passed away from an overdose, 30% were in the construction industry. That is unacceptable. Construction jobs are hard and physical, and drugs today are potent and inexpensive. This can be a deadly combination for someone who has suffered an injury that requires pain management. And as a government, as employers, as co-workers, or as friends, we all need to be vigilant. For our part, we have made naloxone free and easily accessible across Ontario. And while he was in government, Minister McNaughton made several changes to improve worker safety, like requiring all high-risk workplaces to have naloxone on site. I know that Minister Piccini is equally passionate about this issue, and he and I will continue to work collaboratively to keep people safe and get them the help they need. I also hope that all of you use this opportunity to share insights and work on strategies to build a culture of well-being within the industry. As you delve into the discussions and presentations ahead, remember that the industry is not just about bricks and mortar. It's all about the people who breathe life into those structures they create as well. Together, we can build not only communities and homes, but also a workplace community that prioritizes the mental health and wellness of its greatest asset, the workforce. On behalf of the Government of Ontario, I'd like to thank ResCon for taking the lead in this important conversation. Let's move forward with a shared commitment to talking about mental health and addictions and fostering a community that is compassionate, understanding, and supportive. Thank you.
Thank you, Mr. Minister Tibolo, for your encouraging words and for being with us today. Up next, we have Minister Piccini. He's the MPP for Northumberland Peterborough South and the Minister of Labour, Immigration, Training and Skills Development. Quickly.
Hello everyone, it's David Piccini, Ontario's Minister of Labour, Immigration, Training and Skills Development. It's a privilege to be able to say a few words at ResCon's 5th annual Mental Health and Addictions in Construction webinar. For too long, businesses and government have only thought about the physical safety of workers, and I'm proud to say it's rapidly changing. That's why a key piece of our recent legislation now requires workplaces to have life-saving naloxone kits on hand in case of opioid overdose. I've heard firsthand how this legislation is helping to reduce the stigma and save lives. Under the leadership, of course, of Premier Ford, our government is making critical investments in mental health services across the province and tackling the stigma in the process, making sure workers struggling with anxiety, depression, and addiction can get the professional help when they need it and where they need it. I know our work is not finished, and we still have a long way to go to ensure every worker can protect their physical and mental health to get home safely to the family at the end of their shift. And I congratulate you all for taking a stand on mental health and value your opinion and the work that you do. And please know our government will always stand with you to ensure we make Ontario the best place to live, work, and raise a family. Thank you.
Perfect. Thank you both, Minister Piccini and Mr. David, for your commitment to keep working with the construction industry to make sure our sites are both physically and mentally safe. Joining us next, we have Dr. Joel Moody. He's the Chief Prevention Officer for the Ministry of Labour, Immigration, Training and Skills Development. If you've attended any of our health and safety related webinars, you know how integral Dr. Moody has been to every single one of them. He's a public and occupational health and safety leader with over 17 years of experience working in various labor organizations throughout the province of Ontario. He has championed innovative approaches to harm reduction and regulatory oversight and made equity, inclusion, and subjects such as mental health central to his philosophy of leadership. It's always been very important for us to keep up with what the industry is doing related to mental health, and it's even more important to know what the province is doing related to this topic. We've worked very closely with Dr. Moody for a very long time, and this partnership has been very valuable to us and to the industry. So as always, we're very happy to have you join us again, Dr. Moody. The floor is yours.
Well, thank you very much, and good afternoon to everyone. Always a pleasure to be invited to come and speak to an organization that values and recognizes the importance of not just physical health, but also mental health as well. So to Andrew and team, once again, thank you very much for having me here, because it really shows commitment. At the end of the day, the commitment around the issues that we're facing are real and they're important, because it's by organizations that show a commitment to what we're doing and ways to put health and safety first. And we know that that's what you're doing. At the end of the day, a healthy, safe, productive workforce is a winning strategy that we can all rally behind. As Minister Tobolo and also Minister Bettini were saying, mental health and addictions is an issue that affects many different workplaces across all sectors, across all parts of our economy, across all demographics. So it demands attention of everyone, employers, workers, our unions, government. But the research really tells us that, construction, we really need to pay close attention to what's happening, because we heard, injuries, illnesses, the day-to-day that happens with those that are in construction do lead to issues around both acute and chronic pain, and sometimes the exposures to traumatic events that they may encounter at their work site. So I want to say, definitely it was great to see Minister Bettini come and also provide some remarks to the group. As you know, Minister Bettini comes from the environment sector, and he's quickly getting acquainted, getting his feet wet. And we've already seen some announcements both on the skills trade side and also in the health and safety that he's made. I've had the opportunity to brief him, speak with both himself as well as his chief of staff on health and safety. And I want to say he's committed. He wants to make a difference, and we are going to make sure that that does happen. Mental health is crucial in the workplace for many reasons. Because first, it affects how employees cope with stress, perform their tasks, communicate with others, but more importantly, communicate with their communities and their families. The mental health and addictions issues and challenges are very common, and as I said, can impact any job, any industry. So it's important that we find ways that we promote good mental health, well-being, because not only will the workplaces benefit, but both the employers and the employees as well. It's about feeling supported. How do we find ways to create those environments that the employees feel supported, they feel valued, which once again translates into morale boosters, productivity boosters, but just overall good well-being and health. So leaders, we want to make sure that everyone in your organization is supported and committed to supporting mental health in the workplaces. Because once again, it makes good business sense. It makes good people sense. Because no one can argue that the goals are not consistent. Improving personal productivity, increasing culture, goals, reducing bullying, all of those things are so important for the workforce that we need in order to move forward with the goals that we set out in this province. So as you know, the province's 2021 to 26 occupational health and safety strategy called Prevention Works is very clear about mental health, violence, and harassment in the workplace as an area of system focus. So as such, the ministry, amongst all the partners in the system, and all our other stakeholders, we're looking to implement better practices, evidence-informed programs that work and also that are there to address work-related mental health, workplace violence, and harassment. And one of those projects that we are working with is called Addressing Work-Related Risk Factors for Opioid-Related Harms. So this is one of our projects that we've been able to fund. It's led by Infrastructure Health and Safety Association, IHSA. And here are some of the things that those early results are coming in. So first and foremost, the ability to have a resource for employers. And Andrew will make sure that these information are also provided in the links as well. Where we say that opioid use and workplace implications for the trade sectors. So that, this puts opioid use and misuse into context for those employers. How do we find ways to destigmatize the issues that are there? They've also developed a toolkit for the employers and other workplace champions with links, the tools, the articles that really help the workplaces understand, decouple, understand, and basically untie the knot around what does it mean to have individuals, employers, businesses that are associated with staff that have mental health and addictions challenges. They've done some podcasts, safety talks, so many different things that are coming out of these programs. And I want to say thank you very much to IHSA for doing those things. As both Minister Tobolo as well as Minister Piccini said, the Workplace Naloxone program has had tremendous uptake. Providing training for up to 2 people, kit per workplace. And so to date, we've had over 4,200 workplaces that are participating in the program. Amazing. And what we're finding, once again, from those results, 8 out of every 10 learners are reporting that they are increasing the confidence and awareness, both about nasal naloxone, but also about the opioid crisis as well. 85% of those that are taking the program are actually finding confidence in tending to an individual that could be suffering from an overdose or a poisoning. And the other is 81% of the learners an increased awareness of those opioid-related harms. Who's actually taking part? I have my hands off to the construction sector. About 45% are both from the construction sector and the manufacturing sector. So thank you very much for those that are participating. My staff is always asking me, we've done some great work. Can we continue? And the answer is yes, we must. As the former Minister McNaughton would always say, this was the first jurisdiction in North America to integrate this concept into not only a public health issue, but a workplace concern as well. And one thing that we will always say that even if one life is saved because there's access to those naloxone kits, we call that success. Other things that our HSAs are also working and focusing on, in addition to the work that the IHSA has done about the dedicated webpage on mental health and addictions, once again, the toolkits, safety talks. We also have a facilitator's guide about how to actually deliver talks with individuals. Many times we've heard, well, I'm not comfortable. I don't understand. I'm not good. Well, let's find some ways that we can help you be comfortable, because we know that peer-to-peer discussion is an important part of the process, not only from a recovery standpoint, but support. Mental health first aid training to workers to recognize the signs and symptoms of mental health challenges, and then to provide the appropriate assistance. So important. And then, of course, here at the ministry, the ministry's website often provides some resources as well about how do we raise awareness around workplace violence and harassment, especially related to the requirements that are under the Occupational Health and Safety Act. The code, the practice, general awareness, other resources and other tools. But at the end of the day, we know that mental health is often referred to as the silent epidemic. And the construction industry is not immune. We have traditionally heard around the slips, the trips, the falls, those traumatic injuries. But many times we don't explicitly hear about the mental health and addictions challenges. And I'll leave it with this because it's important that we note that mental health and addictions issues affect about 1 in 4 individuals at some point in their lives. And that has an important impact upon well-being. So, it's important, and I say essential maybe, that we find ways to create that culture that supports not only for the employees who are experiencing the mental health and addictions concerns, but how do we also do those things for the broader society? So being aware of these issues continues to be that challenge that I'll continue to raise with all of our stakeholders and partners. But that's why I want to say thank you to ResCon, because you're taking a leadership role. And I want to thank everyone that's here today. So once again, thank you for having me, and look forward to the rest of our speakers. Have a good day.
Thank you, Dr. Moody, for those insightful remarks. We do actually have some questions coming in, and I think we have the opportunity to take a couple. So the first question is, have you seen a change in the perception of mental health issues since you've joined the Chief Prevention Office?
Yeah, I want to say thank you for that question. The answer is yes. I think some of the statistics that we talked about that I mentioned through this naloxone training program, where we are seeing, over 80%, 8 out of 10 individuals who are learning, 8 out of 10 individuals are truly to understanding the construct around what does it mean to have an opioid poisoning. Many times the mental health is forgotten about a substance misuse order. And so finding ways to destigmatize, finding ways that it helps individuals talk about what's happening in society. Because we know, unfortunately, that many times, unfortunately, those that have substance misuse issues are doing so by themselves. And so creating the space, we talk many times about a job, housing, and a friend in the mental health sectors. And so we are seeing change. Is it to the extent that we need to see? No. And so work always needs to continue because unfortunately we're still seeing a disproportionate amount both in society and as well as our employees in the occupational sector that are having substance misuse issues.
Perfect. Thank you for that. The next question that came in is, where do you think we need to go and where do you think the investments need to be made?
Well, once again, I don't want to take the entire time. I know we have other great speakers. I think, once again, the strategy is a very good starting point because, once again, we're talking about the issue. It's not hidden. It's not silent. And people are truly understanding. One of the things that, we talk about the silver lining of the COVID pandemic. Many of these challenges have been known in the public health world for many years. And so the COVID pandemic has allowed us to maybe bring these front and center a little bit more because now it's in the open, we're coming through the issues of isolation, loneliness, have a lot of time potentially, but what does that do for individuals and their mental health? So continuing to keep it front and center, really also looking at, I go back to prevention because it's easier to find ways to prevent than to treat. But we have to make sure that we have that spectrum complete. So it does take primary prevention, but also how do we look at recovery, resilience as examples. And so that's another place for another day maybe that we can talk about, but definitely around prevention aspects, raising awareness and destigmatizing the issues. So important.
Thank you so much, Dr. Moody, for taking the time to answer those questions. We are going to move on to our next presentation now with the League of Champions. So Dan Fleming, the chair, is going to join us with his team. So Dan is a health and safety expert, and he also sits on ResCon's Health and Safety Committee. So I'll turn it over to Dan and let him introduce his team.
Hi, good morning, everybody, and thank you, ResCon, Andrew, and your team for the invite to attend today. Myself, I'm Dan Fleming. I'm the general manager from NORCAT. We're an occupational health and safety skills training provider here in the GTA and in Northern Ontario. I'm current chair of the League of Champions. League of Champions is an organization that supports the construction industry. I have over 80 members in the League of Champions, and We're here with some experts today. Initially, we were told we're going to be an hour's presentation, but we were able to condense that down to 15 minutes, and we'll do our best to get in there. So I'd like to, we're going to slip on a slideshow. I've got, I'll introduce my other speakers here just now. At a high level, we've got Stephen Agla. Stephen's Secretary Treasurer of the League of Champions, and with ACON, VP of, Director at ACON, I believe, Stephen. We have Mike Petrus, right? Petrus, Mike, correct me if I'm wrong. With the Mental Health Commission of Canada, and we have Katie Lechinek. She's also a senior advisor with the Mental Health Commission of Canada. So let me just put my slideshow on here, and we'll get into the show. League of Champions, just as we go to our next slide. League of Champions, what was our mission statement is to advocate for safety by inspiring, influencing leaders to commit, collaborate, and take action to improve health and safety and culture through awareness, education, promoting, and recognition, lead to a safer construction industry. So one of our initiatives that we have with the League of Champions is the Safety Culture Initiative, which is the SCAT survey. We're asking industry to support improvement of safety culture by taking the survey. Any of our 80 members, and we have about 20 or 30 associate members participating in with the League of Champions. We're looking at getting them to participate in our cultural survey to sort of take a measure of your health and safety culture. And I'll just go to my next slide here. Today's features is the mental health initiatives and programs. I mentioned we have Steve Agla. Steve's director of EHS over at ACON and On Express, and he's currently the League of Champions Secretary Treasurer. So with that, I know our time's short, so I'm going to send it right over to you, Steve.
Perfect. Thanks, Dan. Thanks, ResCon, for allowing us to speak at this event. It's such an important subject for us to all talk about. Just speaking on ACON's behalf, we have an annual safety day that we do. And back in 2019, we started with Stop the Silence and start the conversations. And it was all about our workforce is speaking out about mental health. At the end of the day, we dove in kind of head first with it to try to understand it. And when the stats came out, that's what was really kind of eye-opening for us all. Is the most prevalent is obviously, as you can see on your screen, 15 to 24-year-olds. By the age of 40, 1 in 2 will have a mental illness. Substance use deaths per year are 67,000. That's 11 suicides per day. Those stats are staggering. But then when we kind of dove down and into the construction industry, the substance use disorders double the national average. And suicides are 5 times more likely than any other construction fatalities combined. You know, as Dr. Joel Moody was just saying about prevention, this is what we're trying to do. We're trying to get ahead of it. We're trying to talk about it. We're trying to make sure that it's out in the open. And that is just staggering that we do so much when we talk about struck by, fall injuries and things of that nature. But when we're talking about mental health, we just really kind of started that conversation because, again, as Dr. Joel Moody kindly said, is that was a silver lining to the COVID pandemic. And who's most underreported? Imagine it's men. You know, we just finished our campaign with Movember here at ACON and On Express, and we had a lot of support. But this is one of the topics that we really talked about. Now we kind of continued our journey back in about 2021. I was able to start going around to our job sites again and really kind of started to see the difference in people. People that were naturally kind of chatty and upbeat were a little bit different. And heck, I can tell you, I was different. You know, being inside for that long, it was really truly affecting all of us, and the uncertainty was coming ahead of us. So what we said is, I kind of raised my hand when we had our senior safety management team meeting, and our chief safety officer, Mark Shear, I said to him, I said, you know, I think we have to do something about this. At the end of the day, I'm struggling, and I can only imagine what other people's are struggling as I'm talking to them out in the field. And he said, I'm 100% in. You just let us know what we can do to try to support. So what we started is this field support area in our SharePoint site. And it was an area where everybody could go in and access information freely. So we went from the perspective of it's not just about work, it's also about what we can bring home. So we started this, and this is where we kind of started centralizing the information. And then from there, what we ended up doing is we actually started a mental health committee. That mental health committee, as I said, is if you ask, you shall receive. And we just kind of put it out to a bunch of the different departments that we have. And we almost had to actually start shutting down people and saying, actually, it's getting too big. But it was really good to see everybody wanting to put up their hands. And as you can go to the next slide, what we decided as a mental health committee is, first off, we need governance. And then what we wanted to do is say, hey, what can we do? As employers, we're kind of limited, right? We're not here to solve the situation. What we're here to do is to break down the barriers, making sure that stigma is loosened. And then what we ended up saying is, you know what, we got to get more information out. So we started off with X Movement. X Movement really helps children going back to school, and they deal with mental health. You know, our kids were really truly affected by the pandemic and not being with their peers, and stuck inside. So what were we going to do to try to help arm our workforce to help their families at home? So this is why we brought in X Movement. From that, it actually sparked one of our own staff members to say, hey, my wife wants to speak. She's been struggling with mental health. And she actually wrote her own book. So she came in, she spoke to us on Bell Let's Talk Day. And then we started working through our strategic plan of what we were going to do, how we can support people, and how we can move it forward. So that's where we started as the committee. The committee still goes and is functioning very well nationwide for ACON right now. I had the pleasure of joining the On Express project roughly 2 years ago, and we didn't want it to stop there. It's the rail industry, and the rail industry is just as affected as the construction industry. And with all that being said, Dan, if you can go to the next slide, we started a mental health committee here as well. So I chair the one here, and I also co-chair the one back at ACONS. And at the end of the day, what the whole piece around this was, let's put our people first. Let's make sure our people are put first, and naturally we start taking care of the job sites and everywhere we're going to be. So with all that being said, what we ended up doing is everybody who sits on the committee has mental health first aid training. And then further to that, we wanted to make sure that people could clearly identify who they were. So we have specific stickers that go in everybody's hats or on their badges. And then further to that is what we said is the health and safety department and HR departments are going to come together, and we're all going to be mental health first aiders. So now you know where you can go and get those get that help or that direction that you need to get to. So with all that being said, Metrolinx has also joined us around the table, and they sit on that committee with us because we are in a collaborative environment. And as you can see on the right side of your screen, there is our Fit for Duty. So every first week of May is Mental Health Awareness Week. And what we decided was, let's focus on fitness for duty. You know, sleep hygiene is massive. We don't realize how much sleep affects us all, right? And what can we do to better our sleep? So we went there. We also then talked about opioid addiction. And what we have is mandatory training for anybody who's a part of this project. You have to go through naloxone training to make sure that you understand what to do. Then we put it in all our vehicles. We have it in all the AED kits here at the office. And then we wrapped up the week with #MyStory. Again, if you ask, there's a lot of people that will raise their hands. And the most impactful was listening to our colleagues be brave enough to come forward with their own personal journeys and stories and share those with us. And at the end of the day, I'm super proud of everyone that's on the committee and the commitment that On Express and Metrolinx jointly have to making sure that we put mental health first. And that's what we're all striving to do. The work's not done. We're going to continue going down that path. And we look forward to, you know, seeing what other tools that we can put in our collective tool belts to try to help our workforces go home.
Thank you, Steve. Yeah, that's great. It's great to see the work that ACON's doing, and you know, and what you've achieved so far. You also mentioned about other industry groups that are also participating in initiatives too with the mental health. Could you share some of that?
Yeah, so we have generally what we do is we've reached out to a bunch of different people. So we've had the Mental Health Commission actually help us out with a couple different things, which is great. And then we just had industry leaders that want to come and help us, Dan. So that's basically what we've had. We just, as I said, I can't say this enough. You ask and you shall receive. So as soon as we go and ask and say, hey, can you help us out? You know, a lot of times people are willing to just put their own time into it and not actually force payment, which is great.
Yeah.
So that helps with information sharing. But that's basically what we've been doing there.
Great, and it's great to see taking a leadership role with the League of Champions, and a lot of this, a lot of all of these activities, a lot of these resources are all shared through the league with all peers that are all participating on it. So, thanks very much, Steve, for the great work you guys are doing and what you're doing at ACON.
Thanks.
Yeah, I'm going to introduce. I'd now like to introduce. Let's see my slide here. Sorry. This year, League of Champions created a relationship with the Mental Health Commission of Canada, and we're just announced it about a couple of weeks ago that we partnered up, and they've actually joined the league there now. So this was great that we're able to. One of the League of Champions main goals this year is fit for duty, and fit for duty we look at emotional fit for duty, emotionally fit for duty, physically. We look at competency. And mental health is a key part of that fit for duty role. So having the Mental Health Commission as part of the league is a great. So it strengthens our commitment to improving health and safety and improving the outcomes of workers and mental health. So I'd like to introduce Michael Petrus, Director of Mental Health Commission of Canada International, an award-winning anti-stigma initiative, Opening Minds. In February 2015, Opening Minds received an Innovator Award for the organizers of the 7th Together Against Stigma Conference in San Francisco as the program which creates a major impact through new approaches that inspire new possibilities and or disrupt prevailing views. He's also Director of the Mental Health First Aid Canada. I'll send it over to you, Michael, and please, it's great to have you with us.
Thanks very much, Dan, and good afternoon, everyone. A pleasure to be here with you today. Special thanks to ResCon and to the League of Champions. And to see that you're focusing on this area, such an important area, is really inspirational. If you could just move the slide, Dan.
Will do, yes.
So you've heard some really staggering statistics about how mental health and mental illness is affecting workers within the construction sector. A recent study shows that 33% reported a poor mental health, and I would suggest that number is probably much higher. People just not reporting as much because of the stigma associated with mental illness. And at least 2/3 of employees wish that their employers had more in the way of mental health initiatives to support them. So that's from a recent Stats Canada survey done in 2021. Now, what we're really talking about here is the need to change organizational culture. And what we need to do is create a culture where people aren't afraid to seek help. That means more supportive culture in the construction sector, more accommodating, one that communicates and involves its members in the development of programs and the change of that culture, clear job expectations, encouraging help seeking, as I mentioned earlier, and allowing people to speak up without fear. So these are just some of the numerous factors that go into creating a positive culture. And if you take away one message from this, it is that you change the culture within this particular sector. Next slide. I'm going to get you to double click it. One of the major barriers here is stigma. Stigma is a barrier that is so difficult to overcome. And what do I mean by stigma? It's those stereotypes and misconceptions associated with mental illness. Most people or many people think that you can't get better, you can't recover, when in fact just the opposite is true. Stigma is so painful that many people who are living with a mental illness, at least 2/3 report that the stigma they experience is even more painful than the illness that they're dealing with. Stigma was shown to be significantly associated with psychological distress, depression, anxiety, and impaired sleep. And you heard about the importance of sleep. And why is stigma such a big factor within the construction sector? Well, it's a masculine culture. It's male dominated. Things are changing. You're seeing a shift to a change in genders happening within the construction sector, but still it's male dominated. And there's a real macho belief and ethos that It's suck it up. It's something that's all in your head. When in fact we know it's very physical as well. It's just that you can't see it, and that's why it's so difficult to address many of the issues. So why reduce stigma? So if you click again, Dan, you're going to go through a series here. So it encourages early help seeking, better outcome, better prognosis. The longer you wait to get treatment, the more difficult and complicated it becomes to deal with mental illness. It increases productivity if you reduce stigma, and positive financial impact for those on the employer side. Again, Dan, if you can click. And what we're again looking to do is change that cultural shift. So we want to change thinking and attitudes. And a greater acceptance means a more supportive environment. And with that supportive environment, you get more positive outcomes. Change the slide, Dan. So we have 2 training programs. You've heard about mental health first aid, and I'll talk about that in a second. We also have another program called the Working Mind. Mental health first aid, if you want to change the slide, Dan, is really about the same kind of thing that physical first aid is. It's providing people with the training and being able to respond to a crisis in the workplace, much like you would if you had physical first aid training. What it does is it increases recognition of signs and symptoms. It increases better help-seeking behavior. People are not as afraid to go and seek help because they know it's a supportive environment and there are people there that can help direct them. And very importantly, it decreases stigma. So that's another key factor. So we look at that as a downstream program. The Working Mind, on the other hand, is sort of aimed at the individual, and we look at it as upstream or preventative. Change the slide, Dan. One of the key elements in this program, and Dan, you're going to have to click here. I'm going to put you to work. No free lunch for you today.
Worries.
So you can notice the colors, and we call it a gradient, and it moves from green, which is healthy, to red on the ill side, where you may meet the criteria for diagnosable mental illness. Click the slide, Dan. So you can see that arrow slides back and forth so that even though you're moving towards the orange or the red with the appropriate coping strategies, you can move back to the green. And I'll tell you a little bit more about what those colors mean. And the colors are so important because we get away from those scary diagnostic labels, major depressive disorder, anxiety, schizophrenia, bipolar. Instead, people change the culture by using colors instead. Hey, I'm in the yellow today, I'm in the orange, and you have a good grasp of that common language. Each of those colors represents a phase. And if you can just change the slide, Dan. So it allows people to assess where their mental health is. On any given day, we're somewhere on this continuum. It's not meant to be a diagnostic tool. We leave that to the healthcare providers to diagnose. Instead, this just gives you an idea of some changes that may be taking place, that may be an indicator that maybe you're not as well as you think you are. So if you're in the green, you're functioning well, it's easy to handle tasks, good humor, you're not having any physical changes, you're getting the right amount of sleep. So that's where we all want to be, is in the green. When you move into the yellow, it's not necessarily bad. That's where you're dealing with a bit of stress, and some stress is actually good for you. We know, for example, when you're talking about athletes, high performance athletes, or actors, when they sort of talk about stage fright, that's when they're dealing with stress, but it helps them focus and perform at an optimum level. And that stress is short-lived. That's the important part of that. So you're dealing with, want to ask your boss for a raise. You wake up at 3 o'clock in the morning, and you're sort of going through the arguments in your head. Well, what if he says this, and what if he says that, and I've got an answer to this, and I've got an answer to that. So you have your session with your boss, and next thing you know, it works out well, and that stress is gone, and everything is back in the green again. It's when that stress becomes sustained and chronic over a longer period of time, say a month or 6 weeks, that's when you begin to enter into the orange phase, where we call it injured. And there you see quite a bit of difference. Somebody who is normally easy going becomes angered easily. They're having trouble sleeping. They may have nightmares. All of these kind of things are indicators that something is going on. People don't change without a reason. Now, when you get to the red, that's where all of these things become even more chronic. And if you were to go through it, you would see that all of those things that you experience in the orange are even worse in the red, and you probably meet the diagnosable criteria for a mental illness. So this is a useful tool. We teach people how to use coping strategies so they get back into the green, And at the same time, we have case studies and scenarios. And what I'm going to do here is introduce Katie, who can tell you about a program that we're collaborating with, which IHSA, that's specifically directed for the construction industry.
We'll just do
Sure.
a quick 2-minute warning. We just got to keep it moving. And I know this program's great. Just wanted to give a quick 2-minute warning.
I will speak very, very quickly, but all just to say is that we're very excited to be partnering with IHSA, the Infrastructure Health and Safety Association, to adapt this program that Mike is talking about, the Working Mind, for the construction sector. So the way that we do that is we have specific case studies or scenarios that are relevant to that industry, as well as research and stats that are specific to the construction sector, so that when participants are in the course, the material is very relevant for them. And then video testimonials that are included in the course as well from folks who are in the construction industry and who have lived experience. So we're in development on that course right now. We'll be piloting it in the new year and then hopefully rolling out in the spring.
And you can get more information on our website. So here are some links that'll help you learn more about the program and training that we have, whether it's the Working Mind or mental health first aid. So thank you again very much for your time and your interest in this area.
Thank you, Michael. Thank you, Katie. Thank you, Stephen and Andrew, for allowing us time to share some of the resources that we have over at the League of Champions, and also for sharing your stories and the great work that you guys are doing. So with that, I'll stick to our time frame and I'll pass it back over to you, Andrew.
No, we really appreciate it. And there was an incredible amount of information in that presentation. And so we'll make sure that we get those resources out. What we're going to do now is we're going to bring up the panelists. And so maybe I can get some help, Ahid and Meredith, on just formatting everybody. And so we've got a very exciting panel coming up. And so the first thing we're going to do is we're going to let each panelist introduce themselves. And so the first panelist that we've got, and we'll add some more, I see is Kathy Martin. You want to introduce yourself and your organization?
Sure. Hi, my name is Kathy Martin, and I work for the Infrastructure Health and Safety Association. I'm leading the mental health and wellness strategy here at IHSA, both internally and externally for the sectors that we support. So I'm pleased to be here. Thank you.
And then next is Jeanette.
Hi, everyone. My name is Jeanette. I am the Vice President of People and Culture at the Daniels Corporation.
Thanks for joining us. And then next on my screen is Lisa.
Hi, everybody. My name is Lisa Price, and I am the Assistant Director of the LIUNA Local 183 Training Center.
And then Melissa.
Hi, everybody. I'm Melissa Murkar, and I am the Occupational Health and Safety Manager for Menkes Developments Limited.
Perfect. And so my name's Andrew Paris. I think most people know me, and I'm fortunate enough that I get to work with everybody on this screen. And so the secret to what we do at ResCon is we have amazing partners and we have amazing members. And so we kind of want to spotlight and share some of that. So we're going to dive right into it. And the first question to kick us off, and this will be more of like an informal conversation, is going to go to Jeanette. And so Jeanette, you're with Daniels. Daniels is recognized as having a number of best practices, including rapid response, including mentorship, and just a very fulsome approach, all-encompassing approach to mental health. So keeping that in mind, like, how do you as a company promote mental health? Like, do you have some secrets related to training or training related to recognizing signs or symptoms? I'll kind of just turn it over to you to talk about what you guys do so well at Daniels.
Yeah, thanks, Andrew. So honestly, for everything around mental health is we try and provide an organizational culture around psychological safety so that team members are comfortable sharing anything they want to share, and there's not a culture of shame. So it's shifting that very traditional authoritative structure to one that focuses around that more sharing and openness mindset. So we try and do a ton of things around our organizational culture. We do managerial training around Dare to Lead. So that looks at embracing vulnerability and recognizing it not as a form of weakness, but as a source of strength. We try and encourage empathy, curiosity, and a shared purpose. We've tried to operationalize our core values so that those behaviors are very clear in what they look like from day to day. And one of our values is put people first. So it's really trying to create an environment where folks are comfortable sharing And it's also an environment where managers ask questions instead of make assumptions. And that changes the dynamic completely. So it decreases shame in the organization, increases sharing. And instead of saying something like, hey, you were late today, what's your problem? You need to be here on time. And going to someone and saying, it looks like you've been coming in late a lot lately and not really participating as much as you used to. What's going on? Just to ask the question. We also have policies around violence and harassment, which includes domestic violence, which we're seeing, unfortunately. We also have an anti-discrimination policy, and we do programs like Mental Health Awareness Week, and we also have an emergency protocol in place. So if there is a crisis on site, we have everything already set in stone for the contacts. What are the mental health professionals? Who are the health professionals? And we already have those relationships in place. So when there is a crisis on site, we just go, we know exactly what needs to happen. So we're doing a few things.
So it really kind of kicks in. You've thought about it ahead. There's good communication. There's good prep. So it's not about if it happens. It's more about we're prepared for when it happens. And hopefully it doesn't, but if it does, that's very interesting. And then I might turn to Kathy, because I know out of the IHSA, you guys are very much focused on both culture and training as well.
Yeah, no, absolutely. It's great to hear what they're doing at Daniels. And, you know, we just actually launched a podcast on how to get prepared for that rapid response. So if you're on the call today and you're listening and you think, oh, geez, I haven't done that, there is some tools and resources available at the IHSA website and a podcast that you might want to listen to, because that's a really important piece. And also, you mentioned about the culture. I think that is so important. And it was spoken earlier by some of our speakers. I know Mike Petras mentioned it there around culture being really, really key. And all of the work that IHSA is doing is really looking at how do we support the culture. When it comes to mental health and addictions is what I'm focused on, but I'm really pleased to see that Daniels is taking a much broader sort of management approach, because at the end of the day, where does stress come from? In our workplace, it often comes from above, right? It comes from the management and the way they interact with us and how they support us as workers. So that's a really important piece to address, is sort of that management skill and upskilling. And when it comes to workplace mental health and addictions, when you're doing any kind of training, it's really important to start with management first and supervisors first, so that they're equipped with the skills on how to address it, and then have those conversations with the workers. So it's really, really great to see. And
Yeah, and we're hearing a lot of kind of a holistic approach, which is really great to see. And then I want to bring Lisa in on the conversation, because I know you guys are very mindful when you're obviously training new workers, but even people that come back for health and safety. And so, we heard from the chief prevention officer that his focus obviously as the prevention officer is on prevention. But we've also heard several times over the years that an ounce of prevention is worth a pound of cure. And so how do you address mental health at the training center and start to prepare people before they get on site?
And so thank you, Andrew. So a lot of times what we do is when we're doing orientations with new individuals coming in, whether it be existing members or young students, because we do partner with a lot of the high schools, we like to talk about that openness and dialogue. And again, as Jeanette had mentioned, instead of sort of becoming accusatory or speaking to the student like, what's going on, you can't do this, you're removed from the program. We've actually had discussions with our staff, with the instructors, and with anyone who provides any wraparound supports to any of our apprentices, be it members or non-members, to say, what's going on? Is there something that we can assist you with? Is there something, that's changed in your, in your life? Or have dynamics at home changed? Like, how can we support you or provide some way to sort of get you back on track? And typically we find that there is a lot of openness to those discussions, because people just want to be approached in a way that they feel sort of relaxed and feel as though they're looked after and taken care of, as opposed to sort of very aggressive. We also we're starting to implement actually a mental health piece in our diversity, inclusion, and equity training that we do with all of our apprentices. And funny enough, the dialogue of those sessions has sort of organically traveled in that direction. A lot of the times the students that are in those sessions and some of them are experienced members that have been in the field for quite some time, really find a comfort level with the facilitator, with the instructor in the room and with other students that they are sort of paired with for 8 weeks or 10 weeks. And they're open to that dialogue and talking about things just beyond equity, diversity, and inclusion. They start talking about anxiety and stress they may feel, and what happens when I go to a job site and I don't get along with my supervisor, or somebody is targeting me because of whatever the reason may be. So we want to make sure those students know what their supports are, whether it be if there's a rep on site, whether they have their health and safety steward, even if it's through the training center, we can put them in touch with their union rep once they become members. If they're not members, then we want to go back to, looking at where we can direct them and ensure that we're not just sort of leaving them in limbo because they're not members. So we're looking at ways to expand those initiatives for those people that don't have access necessarily to benefits right away.
Mm-hmm. Yeah, and those are good points too, because you're right. You never know where a mental health issue is going to pop up, or essentially like it can be there, but what's the opportunity that people are going to take advantage to kind of raise it or ask for help? And so we haven't heard from Melissa yet. But Melissa, you've been involved in the health and safety committee, I think, since I've been around, and certainly you've been a champion when it comes to mental health and really kind of pushed us to do more. And so first off, thank you for that. The other thing is, I think most people know, a lot of people feel comfortable coming to you. And so for some reason, you've created an atmosphere or an aura that you're okay to speak to, and you're a safe person to speak to. So kind of keeping that in mind, like, how have you done it? And what would you say to somebody else if somebody came to them? Like, what advice would you give to somebody if they're approached and somebody asked them for help?
Well, thank you, first of all, for having me on this panel. As you know, since we have known one another, I was diagnosed about 16 years ago with depression, anxiety, and panic attacks. And you always think that you're okay, nothing's wrong. And when you have that, so to speak, meltdown one day and you have to be taken to the hospital, and you're there for a long period of time, and when you walk out of there, it's like you you feel like you have failed as an individual. That's the feeling that I had when I was first diagnosed. And then more so over the years, and as Andrew is aware, I have become more and more open to talking about it. And especially after having 3 children, that also was a factor. And then when COVID hit, it was like, oh my goodness, schools were shut down. I had one in a high chair, one on one leg, one on the other, working full time from home. It was just absolute chaos. But from that, and from walking around on the construction sites, because generally my week looks like one day at head office, and then the other 4 I'm out on the site with the guys walking around. Right from the get-go, from orientation, it states in a video that we have within our company that I am the primary point of contact for anything related to mental health and wellness. And I go into a little history of my past and over the years, everything that I have dealt with and struggled with from a professional level and personal level. And when I walk around the sites and I talk to the guys, you generally can tell by their overall body structure and how they respond to things with regards to the questions that you ask. And I always stress to many people that I talk to, both on a work level and a social level, it's okay to not be okay. So if I'm having a bad day, I'm very open. If it's one of those days that I'm on site, generally I'll go to the site office first, and then I'll do my inspection of the site. And as people are walking by you, you're asking them, good morning, how are you? Are you okay? And those 2 questions go a long way. And I think more so now, more than ever, not only do we need to be mindful and respectful of how we speak to people, because you don't know what's going on with them, both on the inside with their home life, And when you ask those two simple questions, I find the reaction is tremendous with respect to, I've had people just start crying in front of me. And these are men, and they open up and they start talking. And I still remember this individual. I was walking around and I asked those simple questions. He was in a suite by himself, and all of a sudden he just started crying. And I was like, oh my goodness, what's going on? And we spoke for a good 2.5 hours. And from that, and being able to relate to what he was experiencing and the emotions that he was feeling, he felt a sense of comfort. And I think that's what a lot of people do feel when they're around me, is a sense of comfort, because I can relate firsthand to what they're going through. And it's easy to also jump and recommend and give advice, but it's also different when you've gone through it before. And as you start talking to the individual, they get from you, okay, she has gone through this before, she has struggled. And when I find out that someone is struggling, whether it's now, whether it has occurred in the past, I have many different resources that I provide to them based on where they live, and based on the different resources that are out there, one being CAMH, one being our local hospitals. A lot of people don't realize that you can go to a local emergency department, and when you go in there, you stress to the triage nurse that you are having mental health issues and that you need to speak to the crisis response team. And they have a system that you have to follow. And eventually you do meet up with a psychiatrist that's on call, and you do get the help that you need. Recently, I had an employee within our company that I got a phone call from one of our superintendents and the Toronto Police Services, because he was wanting to jump off of one of our buildings. And we went to CAMH, and it was a process, but we got the help that he needed. And also with the help of Local 183, Lisa, we were just amazed with the resources and the support that you provide to your employees, because we had to utilize the available benefits that you have from a union standpoint. And I still work with him very closely. And it's interesting because whenever he's having one of those bad days, he calls me right away. And I always stress to people also, I have a busy life. I have 3 young boys, full-time job. But when I see a certain individual calling, I always pick up the phone because I know that they need my help, and whatever I'm dealing with at that point in time can be put on hold, because it's very important when you're struggling to talk about it, to be open about it. And that's one thing with myself, is I have that open door policy. I do provide my contact information to individuals, and when they are feeling down or having a bad day, so to speak, they can call me. Because a lot of people, and some people recently have called me that I didn't even know had a mental health issue. And that's another thing too, is we may look completely fine on the outside and have everything together. And a lot of people call me superwoman or super mom. And it's like, you have no idea. There's people that I surround myself with where I feel like I have to be someone that I'm not. And on the outside, I look incredible, and I get that impression that I'm strong, but on the inside, I'm crumbling. So it's very important to be open about your feelings, express yourself. And you know what? More and more people will come to your aid, and we are here to support you. And that's the same within the workplace, is we're family, we're all adults, we're all human beings. And when it comes to mental health and wellness, it's a matter of life and death. So if we can do anything to help someone, and to save a life, then we will definitely do so.
And I think that's a great message, is just having the courage to ask for help. So Thank you for
Yeah.
kind of sharing your story and all the stuff that you've done. I do
Thank
want to
you.
ask Kathy the next question. And so today is partly about meeting individuals where they're at. And as Melissa said, depending where you're at as an individual, don't be afraid to ask for help. But I think, Kathy, we also want companies to be able to acknowledge where they're at in the process. And so whether you're a leader, like Daniels or Menkes and some of the other members that we have at ResCon, or maybe you're just ready to start doing something as an employer, like how does the IHSA meet employers with where they're at when it comes to resources?
Yes, thank you for having me and thank you for the question. IHSA is really trying to, I think, map it out. It's the best way to explain it. We're trying to map it out for employers. So be it you're brand new to this issue, or if you've been at it for a while, what we're trying to encourage employers to do is get a strategy. So we've heard other speakers talk about, a need for a strategy, and the strategy has to be comprehensive. It can't be, and it needs to be integrated. So it needs to be comprehensive and integrated. So you need to have a comprehensive occupational health and safety program, basically, that focuses on that total worker health model, which is looking at the person first. So who's in front of you, right? And how do we support the worker? And through that comprehensive occupational health and safety program, you're looking at all of those elements that we've been talking about: psychological health and safety. And so what are the factors that are impacting people's mental well-being? What is causing mental injury in our workplace? What's the culture like? What are the skills of our managers? So you need to unpack it. And so to do that, we have an employer toolkit on our mental health webpage that I would encourage all employers to have a look, no matter where you're at, because you might learn something by going through it. And there's lots of tools and resources there. So that's, short answer to a very complex question.
And I know we've got the IHSA resources. They're going to be in the guide that goes out. So I'm going to be a stickler here, but my favorite way to end a panel is by asking each panelist for one takeaway. We are kind of up against the clock, so I'm going to try and hold everybody to about 30 seconds. So we'll start with Lisa, if you've got kind of a gem or one takeaway in the next 30 seconds here.
I think just quickly is I would say just keep the dialogue open, which has been the theme of this whole webinar, is make sure that there's an open forum, make sure that the apprentices, employees, whoever it is that you're working with, feels as though they have a safe space to express themselves, to talk about issues, to not be judged, to have no repercussions once they do disclose, sort of any issues they may be experiencing. And even for us, at the training center, we're looking for ways to do better and to really prep those trainees for issues that they may experience out in the world on that job site, or issues that they're currently having that may sort of come to the forefront that they're not even aware of once they do start employment. So we really are trying to get that plan in place and keep moving forward.
Right, and then we'll go to Jeanette.
I think some employers hope that employees can just move on from the pandemic, right? It happened. All right, it's done. Your mental health is fine. We're all back to normal. Let's go. Let's be productive. But that's not the case. And thinking like that won't help you. So to accept that things are difficult, people are struggling, and then take it from there.
Perfect. And then Melissa?
My biggest thing is it's okay to not be okay. It's okay to admit it. It's okay to ask for help. And like I said when I was speaking, ask the 2 simple questions throughout the day, whether it's a family member, a coworker, even your spouse, your children, your next door neighbor. How are you doing? And are you okay? And with those 2 questions, you'll know if someone needs your support and your help and guidance to getting the medical attention and support system that they need in their lives.
Great. And for the last word, we'll go to Kathy.
Well, I think my last word, actually like to tie it to what the Mental Health Commission showed everybody. He showed everybody the continuum with that green down to the red continuum. And I heard from someone recently how they describe that continuum. And I think it's really great from a strategy perspective for employers. So that green to yellow stage, those, we're pretty good, or we're just maybe having a bad day because we're trying to ask for a raise from our boss. Those 2 areas, what we're really doing, what we need to do as a workplace is we need to shield those people. We need to protect them. We need to make sure that they stay in the green and the yellow. So that's all your occupational health and safety, right? Like, you really got to shield those folks. And those folks that are kind of shifting down, you know, into the orange, what we really need to do is have managers and co-workers who really kind of can sense that something might be going on. So they are understanding and they're recognizing those early signs and symptoms. So, you know, they have the Melissas of the world, right? They can kind of sense that, see that something might be going on. And skill them up to have those conversations, right? Ask those questions. And then when they are definitely in the red, you know, they've slipped, they could be diagnosable, they need support. And so what are you doing as a workplace to really have good, strong support network in place for those who are in the red? So sort of that shield, sense, and support is what I'd like to leave folks with. The need to make sure you have that continuum covered.
You know, those are fantastic final thoughts, and really thank everyone for being here and being so generous with your time and all the great work that you do. We're going to turn it over to Meredith, who's now going to introduce our next speaker.
I'm just going to pass it over to Ahid, actually.
Oh, sorry.
Sorry. So up next, we have Jonathan Franzoy from the Benefit Plan Administrators Limited, also known as BPA. He's their Director of Health Management and oversees Leuna Care's Local 183 Health Management Program, which focuses on delivering health and disability prevention services to Local 183 members. Jonathan has dedicated the last 20 years to disability management, having worked with Homewood Health and Organizational Health prior to joining BPA. Thank you for being with us, Jonathan, and the mic's yours.
All right. Thank you. Thank you for having me. Thank you for the introduction. Thought I'd go over today to discuss, provide an overview of Leuna Care Local 183 mental health strategy, as well as our health management services. Review of Leuna Care Local 183 mental health and addiction treatment services. Our brand new inpatient and outpatient addictions program that we rolled out last spring, as well as a new program, the psychological trauma inpatient and outpatient program, which was rolled out just this year, as well as doing a brief overview on the critical incident stress services available to members and the employers. So why do we need a mental health strategy? Well, as we all know, there are many members struggling with mental health issues or supporting a family member with a mental health condition. Accessing appropriate and timely treatment is challenging, especially for those with mental health issues and addiction. Some members are unaware of the benefits and services available through their benefit plans. Many lack the expertise in navigating our healthcare system, as well as our community programs. And if health concerns are not attended to timely, appropriately, or just simply ignored, they will inevitably lead to disability and long-term health issues. So what are our 6 core principles? Number 1, end the stigma of mental health, both personal and public attitudes. Encourage members and their families to seek assistance for their mental health and well-being. Remove barriers to mental health treatment, regardless of social, cultural, economic, and geographic factors. Enhance the accessibility to quality mental health care services by leveraging both digital technology and in-person services. Provide an integrated mental health care coverage to ensure coordination of care for members and their families, and to enable full productivity of members both at work, at home, and within their communities. So prevent disabilities, prevent absenteeism, as well as preventing presenteeism. So at Leuna, we have a health management services department here. It is designed as a member's one-stop destination for support on matters relating to health, disability, well-being, here to promote Leuna Care Local 183 mental health strategy. The program encourages members and their families to seek assistance to address their mental health and well-being. They can come here on site, call us, meet with us virtually. We provide that supportive environment. Our team will partner with members to understand their concerns and unique needs to recommend and coordinate an integrated health treatment program from Leuna Care Local 183's suite of services. Again, so this program is available on site. Our staff meet with members who are dealing with mental health as well as disability and all types of issues, in developing a treatment program that works for them based on their unique needs and what they're dealing with. Our it's to enhance the access to treatment and preventing mental health concerns from becoming disabilities. And if a member does go off work, we have the disability supports there, but we try to lessen the extent and duration of the disability. So I'm going to go through our mental health products here, but I think the overarching message here is that if you are aware of a member dealing with a mental health issue or an addiction, just contact our department. We have a dedicated team here of some of our health professionals who can work with members in coordinating the appropriate service based on what they need, based on what they're dealing with. It could be just small things going on at home to disabilities. So we urge you to forward them to our department. The slide click through. I can't see it for some reason.
Yep, it did.
Okay, perfect. So our member and family assistance program that's available through Life Journey. This is through the VCare app. It's available to members and their eligible dependents. It can be accessed both digitally and over the phone. It's meant to be confidential short-term counseling to tackle a variety of mental health issues, including stress, anxiety, grief, anger management, and then also help with other personal matters such as childcare, elder care, work-life balance, legal, financial, etc. Our mHealth virtual mental health program is an online platform available to members and eligible dependents. It helps address a variety of psychological conditions such as stress, anxiety, depression, and panic disorders. When a member logs into the platform, it starts off with a self-assessment tool. Depending on the outcome of that self-assessment, either cognitive behavioral therapy would be recommended, as well as ongoing case management and coaching through that treatment program, as well as offer a variety of mental health topics, podcasts, etc., so they can learn a little bit more about how to deal with their mental health. We have the Substance Management and Recovery Treatment Program. This is virtual counseling services available to members and eligible dependents. This one is available for those who want to tackle their relationship with alcohol and other substances. So again, it starts off with a self-assessment tool and self-awareness tool. Depending on that outcome of the self-assessment, there's access to addiction counselors, coaching, and whatnot, as well as pharmacotherapy. If medical treatment, pharmacotherapy is required. That one, it's for a variety of it's on the sliding scale of how of your needs. So it could be one who's just maybe looking to just deal with some of their substance use or alcohol, their relationship with alcohol, perhaps on the weekend, to all the way to having a real problem, addiction. Our opioid outpatient program through the Canadian Addiction Treatment Center, or CATC. This one is for prescription and illicit opioid use addiction. It provides priority access to local 183 members and dependents. It has over 70 plus treatment centers in Ontario. The assessment and treatment options are available both virtually and in person. There's medication-assisted treatment, medical supervision, and ongoing assessment, as well as management of withdrawal symptoms, harm reduction, and crisis. So that's a little introduction, not introduction, but an overview of the programs that have been in place for some time. Now I wanted to introduce a few of the newer ones that have been here for just the last couple of years. One being the inpatient addiction treatment program through our Quick Care Expedited Healthcare program. This one is a 42-day residential treatment program for all addictions. It's available to only members. It starts with an intake assessment, which is generally coordinated within 1 week of member contact and can include even admission within that 1 week. Once admitted, they have 24/7 access to medical care and nursing support for withdrawal and medical management. What's good about this program is that it's a full medical hospital, so you can go and actually detox at this center, spend the few days that's required, and then before you enter the actual program with the general public. The treatment is overseen by a team of regulated mental health clinicians and addictions physicians, include CBT, DBT, individual and group sessions, as well as relapse prevention programming and discharge. There's also an intensive outpatient addiction program through the same program. This can either be a standalone program, i.e. the individual doesn't need to be admitted to a residential program, or it can be recommended after discharge from the inpatient program. It is an 8-week intensive outpatient program available only to members, and it includes 9 hours of programming, including 8 hours of group therapy and 1 hour of counseling per week. Our inpatient and outpatient program aftercare is available after the completion of those 2 programs. It includes 10 months of aftercare following the program discharge. The aftercare is offered again in person or via their Wagon app. The Wagon app is a cool tool that they have. It's a dashboard where individuals can, manage their recovery, so they can create goals, track their recovery, talk about experiences, good or bad, and then also it flags high-risk situations and prompts outreach from a clinician. So that continues for after 10 months following the program discharge, as well as there's access to peer maintenance groups as well as family workshops. A brand new program that was just launched this year is the psychological trauma recovery, also through our Quick Care program. This one is a 57-day inpatient program. This one is available to members only. This is for individuals with a PTSD diagnosis. Treatment is overseen by a regulated, obviously, team of mental health clinicians and addictions physicians. They offer as well the CBT, DBT, CPT, exposures therapy, as well as individual and small group sessions. They also provide management of concurrent substance use and mental health disorders. Just like the previous program, it's the same location. It can manage both. Some people are dealing with both conditions, obviously PTSD and addictions, or other mental health disorders. They address it all as part of the program. There's an intensive outpatient program that's available as well. We haven't seen anybody enter that program. Most of the individuals have gone right into the inpatient program, and that one also has an aftercare component of 12 months. I'll give you a bit more information here about the program itself. I know time is at a premium, so I'm going to gloss over those, and you can look at them once the slides are shared. And then last is our critical incident services. So some of you are aware, critical incidents can happen at any time. Critical CISD or CISM is an intervention protocol developed specifically for dealing with traumatic events. It is a formal, highly structured, and professionally recognized process for helping those involved in critical incidents. Critical incident can be any highly stressful incident, including it could be death or bodily injury. But it could also be like emergency response or natural disaster, affecting a large percentage of the workforce. If ever there is a need for critical incident services, you can give us a call and we can coordinate that. They're available 24/7. That's through LifeJourney, who are the providers of our number and family assistance program. They will coordinate on-site defusing and debriefing meetings. These are obviously coordinated within hours of the incident. And they are, as we know, the goals are to provide information, normalize reactions, reduce the emotional stress and symptoms, and identify individuals who may need additional treatment. This is not like psychology or psychotherapy on the spot there. It's mainly to ensure everybody is safe. They'll provide psychological first aid for those individuals showing distress and in need of self-care and personal protection. But the idea here is to make sure everybody is okay and identify those who may need some additional services after the fact, which will be coordinated. The LifeJourney on-site crisis incident response process, if an incident does occur, follow your organizational protocols to secure the site and deal with the situation. If the service does need to be coordinated, give our department a call. They'll triage that with our LifeJourney providers. They'll then coordinate directly with you in intake to understand who you are and what happened and who the contacts are. And then the actual trauma team will reach out to the contact to understand the needs and coordinate the service itself. On the day of the actual meeting, the trauma response team from LifeJourney would meet with the on-site contact, assemble other participants, and conduct the actual defusing and debriefing. which could be anywhere from 20 minutes to 2 hours. And then that would be ended off with a phone call a few days later to see if there's any additional supports that are required. LunaCare Local 183 is, in closing, is committed to building healthy futures for members and their families by working towards a comprehensive mental health strategy. LunaCare Local 183 aims to help improve the mental health and well-being of its members and families through integrated services and supports for those struggling with mental health and addictions. If you're aware of anybody who needs any support, again, our contact information is there, and please, we urge you to give them a call, to give us a call and try to assist. Thank you.
Perfect. Thank you, Jonathan. That was super informative and provided us with a great overview of the services available. So moving on, we have Tamar Spielberg, which is she's a therapist from Balance Through Therapy with over 20 years of experience in child, family, and couples therapy. Tamar works extensively every day to help people overcome their mental health issues and other personal struggles. I'll pass it over to Tamar so we can hear more about the benefits of therapy.
Hi, everyone. My name is Tamar Spielberg, and I am a social worker, and I have been a practicing therapist for the past 24 years. So I'm just going to try to share my screen. So today I will be talking to you about therapy and how it can benefit you. So construction is hard. Sorry. Okay. So construction is hard work, but I don't really need to tell you guys that. It is both physically and mentally challenging. This may lead to aches and pains, which may result in the use of doctor-prescribed medication or the use of illicit drugs. This has become a global issue among construction professionals. According to a survey conducted in the US and in Canada, the construction sector ranked among the top 3 industries for things like illegal drug use, prescription drug abuse, heavy alcohol consumption, and substance abuse disorder. According to a survey done in 2007, an increase in the number of reports of poor mental health and substance abuse were recorded in the construction industry. According to WorkSafe BC, there was a 25% increase, which I think is very high, in claims of mental health between 2017 and 2019. Another report showed a higher amount of opioid-related death between 2018 and 2022. Now, I'm not sure about you guys, but for me, this screamed help and therapy. So what is therapy? I'm going to tell you a little bit about therapy. So therapy is also known as psychotherapy or counseling. It is the practice of addressing somatic reaction, which is basically physical sensation, as well as harmful behaviors, feelings, relationship issues, and other issues that the individual struggles with. Right. How do you know if you need therapy? There are basically 4 indicators that can really help you with that. The first, the issue the individual is dealing with begins to affect their daily functioning. So that would be eating, sleeping, difficulty to concentrate, etc. Second, the individual begins to rely on unhealthy and dangerous coping mechanism, often drug use or alcohol consumption. Third, friends and families are concerned. And the fourth, the individual have tried everything and nothing is working. There are a number of different types of therapy, and I will just mention a few of them. They're the major one, but there are a lot more, especially with progress. The more we do research, there are many more different kinds of therapy that are not mentioning here, but these are the major ones. So the first one I speak of is psychotherapy, also known as talk therapy. In this type of therapy, the individual discuss with their therapist their issues and struggles to arrive at a solution. Next, I would speak of cognitive behavioral therapy. It is also known as CBT. Many of your doctors might say CBT. The therapist here, the therapist helps the individual change their distorted narrative. This distorted narrative is what causes the individual to suffer from anxiety, panic, depression, and it's the therapist's job and work is to help the individual learn how to come with new narrative that are not distorted and are more healthy. Next, I will speak of acceptance and committed therapy, also known as ACT. Here, the therapist helps the individual accept their thoughts and feelings, so even if they're negative, without trying to change them, different than CBT, but still committed to an action plan to improve their lives. Dialectical behavioral therapy, also known as DBT. Here, the therapist helps the client accept two opposites ideas. So like, my life sucks and I can't be motivated to do anything, but still focuses on changing the problem behavior to a more effective behavior. Last, I will speak of psychoanalytic therapy. And here the therapy, this is probably the most one common with Freud and, lying on a couch, where the therapists explore with the individual their unconscious mind to understand why they do what they do and find a healing. There are a number of formats of therapy: individual, group therapy, and couple of family therapy. The choice of the type, the format of the therapy really depends, in my opinion, on the individual. It really depends what the comfort level of the individual. So some people feel more comfortable within a group where they are together with other people that deal with their same issues, and they feel more comfortable opening up there. Like an example of that will be like an AA meeting, okay, where everybody there deals with addiction. Some people don't feel comfortable in a group setting and feel that they will not really open up and talk about their individual issues. So for people like that, individual therapy obviously is more useful and beneficial. And of course, there is family or couple therapy where the issue that the individual deals with is really impacting the larger system, so their partner or their family. You can see from this slide that therapy can help in many areas: depression, anxiety, addiction, mental health disorder, PTSD, loss and grief, and many, many more issues that the client might be dealing with. Prior to coming to therapy, it is recommended that the individual complete a self-measurement assessment as shown in this slide. There are many more that either the different therapists will provide the client. I know there's a lot that can be found on Google, but always be careful from Dr. Google. So I will give you that one. And in this form of measurement can truly help the individual and the therapist determine where the individual is at and how they feel and where the therapy can start. So moving along to drug addiction, which I know is something that the panels before me has spoke of as well. There is often a correlation between poor mental health and drug abuse. The definition: drug addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control despite harmful consequences. Over a long period of drug use, the brain started to change, which makes it challenging to control and resist the craving for the use of the drugs. So it's not just the craving. Most people think that it's just like a physical craving. What we have learned that over a long period of drug use, the actual brain structure and the way the hormones and all the chemicals in our brain do take change, which will make it very difficult to stop. This loop results in a strong craving to increase the dosage of the drugs to satisfy the dopamine craving. So dopamine is a major factor chemical. It's a factor in many things. It's basically the craving dopamine of the good, the need, the desire. We can find it in many, many different facets of our life. Drugs is definitely one of them. Over time, the brain gets used to the high, craving a higher doses, resulting in a higher frequency. Often, user who tried to stop their use relapse, and that would be definitely an indication that a professional treatment is needed. So because there is a chemical change in our brain when there is a chronic drug use, just stopping it, it's very, very difficult, but it requires also some behavioral changes, understanding, again, the way the mind think, distorted reality and such, to help the individual, quit the drug use. And as spoken with by the panel before me, a lot of treatment centers, both inpatient and outpatient, can help with that. So what is common for addiction? Many people ask me that. I think there is a rainbow, a variety of reasons. Some is genetic. So we do find that some individuals do have a predisposition, so a genetic predisposition to have more of addictive personality. And, some people, and I'm sure you heard it throughout your life, saying like, I've tried, this drug once, or even a cigarette, and I never wanted it again, or I never had a craving for it. And some people say that after the first time, they were hooked. So genetics has something to do with it. Family history, mental health disorders, peer pressures, and social influences. And here I include at social influences at the workplace as well. Early use can definitely affect that, because as you remember from the slide before, it does affect the changes in the brain. And the earlier you use drugs or any substance use, what happens to the brain before it developed, it will alter it even further, and it will actually make it a lot harder to change. As well, the use of a highly addictive drugs will make it more difficult. So why are we not all in therapy? Well, though I think we should all be. There are definitely some myths and stigmas that are floating around that unfortunately prevents from individuals who can truly benefit from therapy take that step. So on the screen, you can see a few of them, and I'm just going to speak for some of them. I mean, I think you get these slides so you can read them yourself. But often people do believe that therapy is for the weak, for the people that are mentally ill or crazy. And I really don't think so. As I mentioned before, therapy is really just to deal with some issues. So it doesn't mean you're weak, it doesn't mean you're mentally ill or you have any kinds of disorder. It just means that you confronted a struggle, an issue, a challenge, and somebody with some education, experience, and just an outside look into the matter can truly help. I think that some people think that therapists are just there to listen, for the clients to vent. I can tell you that I definitely allow my clients to vent sometimes, but I truly believe that I'm not just there to vent. I always say to my husband that I don't care if they will fire me, but I will definitely tell them what I think is good for them. Some people believe that therapists can prescribe medication, and that is not true. Psychologists with a PhD or doctor or psychiatrist are the only one who can prescribe medication. For myself, I'm a social worker. I have a master's degree in social work, and I can definitely not prescribe any medication. Some people believe that the problem can be solved in 2 sessions. And although I wish that, because sometimes that is the attention span of some clients, it is not true. Some people believe that if I start therapy, I'll have to be there forever. And I can definitely tell you that I don't hope that for anybody. And just for you guys, I think that some people do believe that therapy is not confidential, especially when some therapists are provided by the company you work on or your health benefits. I can let you know that all therapists, depending, nothing to do with any of the colleges that we belong to, if it's psychology or social work or anything else, we're all bound by confidentiality, and it's actually illegal for us without your written consent to say anything. So it is confidential. So although there are many fears surrounding therapy, there are many benefits as well. And some of these benefits include an improvement of communication skills that you learn in therapy, healthier thinking pattern and greater awareness of negative thoughts, greater insight about your life, ability to make healthier choices, better coping strategies to manage distress, and strong family bonds. So just in case I did not convince you, the following are some statistics that were collected through a survey regarding therapy. So 90% of clients satisfied with the quality of the therapy they received. 84% were satisfied with the progress towards personal mental health goals. And 78% believe therapy played a big part in meeting those goals. So I hope that this session was informative and I gave you greater insight to therapy and its benefit. Thank you.
Thank you so much, Tamar, for joining us today. That was super helpful and really outlined the benefits of therapy. We do have some time for some questions. So I do have some coming in right now. So to start, how does someone get started? So for example, how do they reach out and what would their first steps be?
So I think that most people, just because of today's world, will Google most likely. And, you know, some people Google somebody in their area, or they might heard of a person and so a reference that way. So I think some people will go through the internet. A lot of doctors will have kind of their stack, or companies have their stack of therapists that they recommend. I think that most doctors will give you a couple of therapists. I do recommend you call the therapist, look at their website, you know, maybe just have a few minutes, because I do believe therapy should be a good match, kind of like a good marriage between you and the therapist. And you really need to feel comfortable, because you will explore a really difficult situation and issues, and you need to feel that there is trust, there is comfort level, you know, some sort of alliance. So basically the first step is find the therapist, call the therapist. Most therapists have it on their website, immediate like email and way to connect and book an appointment. And then I guess you take your first step.
Perfect. Thank you. No, it's really important, I think, to kind of shop around and see what therapist suits your personality best.
Absolutely.
The next question we have is, how long does therapy last? So each session, the total duration, when can somebody stop going? How long does it take to feel better, type of thing?
So most therapists will either have a session 50 minutes or 60 minutes. Some therapists take 50 minutes and then finish their notes. I have to be honest, I take 60 minutes with the client. I do take notes while I'm in the session. So it will be between that. I think therapy is it's an individual experience. So some clients will, depending on the issue as well. So some clients have come to me and be like, Tamar, I just have this like issue with my children, or like at work. And then they come to me, even some clients come to me when they're on a medical leave. And literally I see them for the duration of their medical leave, and then they're back to work and they're doing well. So I really believe that it's, you know, it's very, very independent to the client and their needs. And again, like I personally believe that, you know, I always again say to my husband, if I'm good, they will leave me. And I think for me, that's a good thing, right? So like if therapy worked, then the client should be able to manage and function without therapy. Although I have to tell you, like I have clients that have come to me 10 years ago, and then I haven't seen them for a long duration of time, like years. And then they come back because they had another issue and they felt that the alliance was comfortable and good, and they come back. So it really depends. I think a person should feel comfortable leaving. Never stay, like I always say to people, therapy should never be stressful. So if you feel that you have done your, you know, your due time and you feel better, or even if you don't like the therapist, I think it's extremely important that you will advocate for yourself and be able to leave when you want to.
No, I think that's a great point you just made. I think it's super important for people to feel like they have got better and that they can leave therapy, but also knowing that they are available in the future if you need them again. So the next question is, when it comes to confidentiality, if I disclose an addiction, substance abuse, or mental health issue, what does a therapist disclose? Like, is that going back to the benefit provider, life insurance company, employer, or law enforcement?
No. So I think, as I mentioned in one of my slides, we are governed by absolute confidentiality. So nothing that, first of all, you own my notes. So anything in your file is yours. So absolutely nothing comes to anybody else. Sometimes I had clients who actually asked me to write a letter to their health provider, let's say to extend their medical leave or anything like that. Even in that case, even if there was a verbal request, as a therapist, I must have a written consent with everybody's name, allowing me to write a letter. And then I would write the letter, show it to my client, have their consent, and then send it to the provider. So it is very, very confidential. And, just because even if you pay the insurance for the provider, it doesn't mean that you get to know personal information about the individual. So very
Perfect. Thank you. Next, how can I tell if I am addicted, depressed, or suffering from a mental health issue? Are there any self-tests you would recommend, or how do they get more information on what they should do first?
So again, there are many, many assessments online. As a therapist, like and many other therapists, we all have our own assessment, not that we wrote them necessarily, but ones that we have collected that we believe will give us the best indication of what works, or what some of the struggles for that client. I do believe that doctors also have their own questionnaires that fill up. So for me, the main thing will be that if you're starting to feel not well, and things like I said, the 4 indicators, it's really truly starting to affect your daily functioning. Unless a therapist that you already have a relationship with, I guess I would say that the first step is your doctor. And here, of course, I hope that you feel good with your doctor, you feel you can trust your doctor. To some form of therapy, like psychiatry, you will require a referral from your doctor. Some health benefits, I think, might require a doctor's note to come see the therapist. So I don't know, that really depends on your health provider. But I think, the first clue is if you keep on bumping into the walls as you go through the day, I think something is a little bit off and you should go see somebody.
Thank you. I think we have time for one more question. So I work as a health and safety representative on site. I think one of the workers is suffering from a mental health issue. What should I do?
So, because I believe that mental health can be very difficult and it requires a lot of care and trust around it, I personally would recommend for the individual to go talk to the person that they're worried about first, right? To explain to them that I do, because you don't know what the mental health, if it's anxiety, paranoia, anything like that, that going behind their back might actually be more detrimental to them seeking therapy and feeling good. I think in some cases, the individual might need you to be with them as they start the first steps. So I would say that you should talk to the person. If it's something like a terrible addiction where intervention is needed, then of course I would say consult with a professional first and then decide how to approach the situation.
Perfect. Thank you. Thank you so much for joining us today. It was a pleasure to have you here, and it was great to hear more about the benefits of therapy.
Thank you so much for the opportunity, and I do wish well for everybody. Thank you.
I'll just pass it over now to Ahed for our closing remarks.
Thank you, everybody, for being here with us today. So we've heard a lot about mental health awareness and just fighting the stigma of mental health and making sure that people feel comfortable to speak up. We've also heard about the importance of prevention and the role that employers play in prevention. There needs to be a plan in case something does occur. Leaders need to be trained on mental health. They're not expected to know how to do it right away. And it's also very important to keep in mind how you're speaking to others and if you're asking about their day or not. So just a few housekeeping notes before we end it. This webinar is recorded and it's going to be shared in our post-event summary. We've also created a bunch of documents that include resources, takeaway notes, and also speaker information. So that's all going to be included in your post-event summary that'll be going out tomorrow. Thank you very much again for joining us, and thank you to all our speakers for being with us.